And
Absolutely.
even if the literature says, hey, turns out that, and I'm not saying, I don't actually know that this is true. I would
Sure.
hypothesize that it is, that, when um, a doctor is not wearing kind of alienating uniform that gives them sort of hierarchical authority over you, that
Right.
there's probably a better bedside manner, that you have a better relationship with that person.
Yeah.
um, it's easier to connect with that person and not to feel like, oh gosh, this person knows better than I do, so I won't tell them the like they said. Right, we
Yeah.
defer to the expert. So but if the doctor comes in not wearing scrubs or whatever, all of a sudden you're like, what's going on here?
Yeah.
There's something's wrong. So it's behavioral change is complex in this way, is because we have these kind of status symbols and identity that are really create kind of an internal resistance to changing that.
Yeah.
That we like, it makes us skeptical, or
Yeah.
there's some loss. Like, I don't, is this good? I'm not sure. And it takes someone to be brave and risky to say, I don't know, I'm going to give it a try. I'm going to try
Yeah.
something else and see how this goes. But I
Yeah.
mean, think about all these, um, there are like pseudo medical shows on TV
Yeah.
where the doctor is wearing scrubs,
Right.
right?
Yeah.
Like, okay, what are they saying in their outfit? Or they're wearing a white jacket, or they're wearing something
Yeah.
that sort of signifies, like, I am the doctor.
Right.
um and it's sort of an interesting thing to think about, like, this is all part of this system that we exist in, that makes it very
Yeah.
hard to change, because if you're a doctor, you have a persona. As a doctor, you're a different person when you're not
Yeah.
at the hospital, or walking around with your stethoscope around your neck and your, tag your name on your jacket.
Yeah. Which is what this show is about, is for us, it's coming authentically to medicine as who you really are, who you are being in the moment. And we often, and I was guilty of this early on as a clinician, is, they always say, fake it till you make it, right? So you just put on this persona, and you put on this idea that I know exactly what I'm doing, and this white coat's going to help me do that, right? Rather than coming from an authentic place where I can just relate and be with you and listen to you, and then find a way forward with you, even if I'm struggling